right, class, here we go. We're going to talk about a drug today that we give a lot to our heart attack patients, and we're going to talk about why we do that and why it's so important. But it is, of course, the wonder drug that works wonders, and that is known as aspirin. Okay, so with that being in mind, some of the more trade names that you will know it under is it's actually acetylsalicylic acid is the trade name for the generic name for that. But we know it as aspirin, ASA. Bayer is the actual trade name. Bufferin is another one. Matter of fact, a BC powder, bufferin and caffeine. Okay, so it works great for a headache, by the way. It's used as an anti-inflammatory. It's a non-steroidal anti-inflammatory. That's what NSAID stands for. But it's a platelet aggregate inhibitor. To put that bluntly, it makes it to where the platelets don't stick to each other. They have a hard time forming the net that they need to start forming blood clots. And again, there's going to be some times where that's a good thing. So that helps also, by the way, with fevers. It helps with inflammation as well. Again, like I said, good things here. So again, it does not, this is the very technical stuff which basically says it doesn't allow us to form the nets. And why we use it a lot for our cardiac patients is because, again, if they have microvascular disease, we want the platelets to be slippery so that they will go through the vessels that are already narrowed down in the heart, okay? We absolutely love it for that, okay? So it reduces the mortality rate of a thrombolytic stroke or a heart attack. The way that a heart attack works, guys, is you get a blood clot that forms in the coronary vessels. So again, if we can make those platelets slick, it won't form another blood clot, which won't stop up the vessel, which is, again, like I said, a good thing. Now, it does create there are several blood coagulation factors, but 7, 9, and 10 are the ones that it actually works on. It inhibits vitamin K, and again, it's an antipyretic. So in other words, it does reduce fevers, okay? It's usually irreversible for the life of the platelet. So once the platelet has been exposed to aspirin, usually it takes 7 to 10 days before that platelet gets recycled, okay? Now, does it do all of your platelets? And the answer to that question is no, okay? However, it does it enough to where it will significantly slow down the clotting process. Now, usually takes about 10 minutes for this stuff to work, and that's usually because of the absorption into the body. And it usually lasts for about 2 to 4 hours, okay? So again, we give it for new onset of chest pain if we think that it's cardiac in origin, okay? Again, if I'm feeling a tearing pain, I'll probably want to stay away from it. Again, tearing pains usually go with an aneurysm. And again, at that point, we want the blood clot to form, okay? We use it to reduce fever as well. If you have osteoarthritis, it helps reduce the inflammation from that. And again, if they have a cerebrovascular accident, but I've got to really stress this one, it really helps on your thrombolytic strokes. If they have a blood clot, it works great. If they are having a bleed in their brain, this stuff is going to accelerate them dying, okay? So you do not usually routinely give it to a patient because they may be having a stroke, okay? I can't stress that one enough. Again, once we get to the CAT scanner and we find out that it's not a bleed, it's probably not a bad idea. All right, so it can cause a little bit of confusion, dizziness, flushing. It can cause blood pressure drop. These are very low things that are going to happen. But the thrombocytopenia, which is your low platelet count, that one is actually kind of a common thing that happens. So you're going to lose those. But aspirins can cause you to get a lot of nausea, vomiting, heartburn. Remember, it is an acid. You're adding acid to more acid. So it can, and eventually, by the way, it will start to eat through the lining if you continue to take high doses for a long period of time. It can cause respiratory alkalosis, and it can cause some wheezing in an allergic patient, okay? So it can do these things. Usually the asthmatics, we try to kind of stay away from the aspirin. Again, it can cause, the other two big ones is it can cause tachycardia, and it can cause tinnitus, ringing in the ears, okay? So it can cause those situations to happen. Now, I would probably know my contraindications for aspirin. Children under 12, the reason that we don't give it is due to the fact that they may end up with Rye syndrome. So we kind of stay away from that. Pregnancies, we usually stay away. It does cross the fetal barrier, causes some problems. If they have severe asthma, again, it can cause bronchospasm from that. If they're allergic to aspirin, of course, known hypersensitivity. And if they have a history of gastrointestinal bleeding, we don't want to throw another problem in with that. Any type of ulcers, again, asthmatics, you got to really be careful with the drug. If they are diabetic, I can tell you I take an aspirin a day, and I have been for about 8 years, and I haven't had per se any problems with it. If they have an aortic dissection, it's probably not a smart idea to give them a blood thinner. It helps them bleed out faster if it actually ruptures. Again, avoid the use of anticoagulants, alcohol, and steroids. Okay, if you take an anticoagulant and then you take another anticoagulant and then you take a third anticoagulant, again, basically you're not going to stop bleeding once you nick yourself shaving. Alcohol will thin out the blood a little bit, so therefore, again, it will cause more bleeding. And administration with antacids may reduce the blood levels, and it reduces the absorption, so you can't just take a Rolade with it to stop the gastrointestinal issues. Again, make sure that they not any before you give it to them. Make sure they're not allergic to aspirin. And then again, the large dose may actually decrease the blood sugar level, so you got to be really careful about that. If they develop ringing in the ears, if they develop tinnitus, you should not be using aspirin, okay? And then administration of aspirin with antacids, again, it can reduce the absorption. So what do we usually do? It's usually 1 to 4 tablets. 81 milligrams is kind of like your daily dose. When we're giving it for a heart attack, usually we get 325. And when I say chew it, chew it. You want to gum it up real good. You really do. Chew it, because that's going to help it absorb a lot faster. Once it's going to get it through the stomach faster, it's going to get it into the small intestines where it's going to absorb. Okay, your pediatric dose is usually for a child that's greater than 12 is 65 milligrams per kilogram, and 24 divided by the dose every 6 hours. The polite way of saying that is pretty much it's going to be around either 1/2 to 1 tablet. I would always consult a physician before I did that, before giving that dose. Guys, it does have harmful effects on the human fetus. So again, we want to be careful with giving it. It's not to say that you can't give it, but again, I would probably not give it to a pregnant patient unless the benefits outweigh the risk. All right, that's going to do it for aspirin, okay? And I'm going to talk. And one other thing, by the way, when you give it in my mouth, have a little bit of water if you can. Have them take a sip of that water to get the orange down. Believe it or not, remember I said it in oral glucose where the orange tastes pretty good. The aspirin orange, well, they kind of missed the mark on that a little bit. So they do have different flavors for that. All right, guys, I'll talk to you on the next one.